We have now administered almost 130,000 doses of vaccine and have fully immunized about 37,000 Albertans. I am pleased to say that 71% of residents of long-term care and designated supportive living have now received both doses of vaccine. These people are most at risk of severe outcomes, and the rest will receive vaccines in the coming weeks, according to their immunization schedule. Others who are 75 and over, who live in supportive living sites not in the designated category, will be offered immunization when enough vaccine arrives to begin the seniors' immunization rollout. Over the last 24 hours, we have identified 339 new cases of COVID-19 and completed more than 10,800 tests. Our positivity rate currently stands at about 3.2%. I continue to ask all Albertans to stay home and get tested if you experience even minor COVID-19 symptoms or if you were a close contact of someone with COVID-19. Testing is important to be able to understand how the virus is spreading in the province. There are currently active alerts or outbreaks in 303 schools, or about 13% of schools in the province. Currently, these schools have a combined total of 867 cases since January 11th. Overall, we have detected 16 new variant cases in the province, thanks to our aggressive testing of the vast majority of new cases. This includes new cases linked to a school. We were informed today that there are now 2 cases of variant COVID-19 where in-school transmission is likely the source. I am aware of 7 classes in 6 schools overall where a variant case has attended while infectious, and despite rigorous follow-up, this is the first time in one of these schools that we have identified variant transmission occurring in that location. Health officials are responding and making sure that anyone who is at risk is in quarantine and being offered testing twice. We are being extremely cautious to protect the health of everyone involved and to limit any future transmission. Just as our currently dominant strain of COVID-19 occasionally spreads in school, we will identify occasional examples of variant transmission as we are sharing today. However, knowing about variant cases means we can limit further spread, and the majority of in-school exposures so far have not led to transmission. Fortunately, we continue to see a decline in our hospitalizations. There are 421 people in hospital, including 77 in the ICU. While this is well below our peak in December, it is still about 5 to 7 times higher than our total during the spring and summer. We will continue to watch these numbers, as well as our leading indicators of positivity rate, case numbers, and growth rate over the next few weeks. Over the last 24 hours, 6 new deaths were also reported to Alberta Health. My sincere condolences go to the families, friends, neighbours, and caregivers grieving the loss of these individuals, and to anyone mourning the loss of someone they loved for any reason. What we've seen in other places around the world where the variant strains have become dominant, in many of those places the variant strains were introduced prior to recognition of them, and they unfortunately had already become relatively widespread before measures to prevent their spread were put in place. So what we're doing here is the aggressive testing I've mentioned before, where we are screening all of our positive cases for variant strains so that we're able to put more intensive intervention around those cases and really treat our variant cases with a containment approach to try to prevent any further spread. And we know that with easing restrictions, there is a potential for people to come into contact with each other in some of those locations that are starting to be opened if the protocols are not followed. So again, this is a reminder that the only way that the reopening will be successful is if the protocols that are in place are followed.